though I live in the United States where healthcare is abundant, I realized that a lot of the people in my life did not have access to good, high-quality healthcare.
Of all of those areas, what interests you the most?
How powerful partnerships can be in healthcare, because I am much better at bringing other people's fully baked solutions to the table.
What do you think is the blocker for them to adopt technology?
The research shows in healthcare we are really lagging behind integrating new and innovative things. I think that one of the greatest things that has happened to healthcare is,
where do you see the biggest opportunity?
with technology, I think you're going to start seeing...
What has surprised you the most?
I'm constantly dealing with what I'm about to say in the Healthcare Business Network. I was really shocked by...
Hi everyone, welcome to Healthcare Journeys, where we explore the stories behind the professionals shaping the future of healthcare. I'm your host, Claudia Gallardo, and today we're joined by Johnathon Koski. Johnathon has a wealth of experience in the healthcare space, currently serving as the founder and director of operations for the Healthcare Business Network, where he helps simplify the complexities of healthcare for his clients. We're excited to dive into his journey and insights today. Welcome, Johnathon.
Hey, Claudia, thanks for having me.
Thank you for being here. So excited to have you. We've talked about having you in the podcast, so we're finally here. You've been traveling all around the country, so we're glad that we finally find you at home so we can episode with you.
And I'm very glad to be here. Seriously, thank you so much.
Awesome. So first things first, we want to know about your journey and how you first get started in healthcare and what inspires you to pursue.
Well, Claudia, how much time you got? So I'll tell kind of the in-depth story here. So I grew up in a little town surrounded by corn in Southern Illinois. And unfortunately, by the time I was 16 years old, I unfortunately had 3 family members pass away with pancreatic and breast cancer. And really led me into this journey and into realizing that though I live in the greatest country in the world, right? Though I live in the United States where healthcare is abundant, I realized that a lot of the people in my life did not have access to good, high quality healthcare. In fact, the closest hospital that could have taken care of my family members was an hour and a half away. And it was really kind of an eye-opening experience from a very early age. And so it really led me down this path of trying to figure out how to make the healthcare world better. And so I actually started off as a radiology technologist. A lot of people don't know that about me, but I started off as a radiology technologist, and I was giving a modified barium swallow study to a patient when a speech therapist said, "Hey, Johnathon, I think you would be a good speech therapist." And I thought, you know what? Let's try it. Let's see what happens.
That is a very different field.
Yeah, exactly. Yeah, I was still trying to figure out what I was going to do with my life. I just knew it was going to be in healthcare. And so from there, I became a speech therapist. I worked with a great company in skilled nursing facilities and working with veterans. And then I eventually became an operations and marketing consultant for a post-acute care provider across the country. And then eventually a director of business development. And so now through all this experience and work, I've been able to finally create the Healthcare Business Network, where we act as the business development arm for innovative healthcare organizations. So we're doing great and excited about our growth. Though we are quite young, we're only getting started. So I'm really excited.
Well, so that's quite the journey. Which one of all of those experiences do you think impacted your career the most so far?
Yeah, definitely. So this is another thing a lot of people don't know about me, and that's a great question. Whenever I was dealing with the passing of my uncle, he had pancreatic cancer. He found out he had stage 4 pancreatic cancer, and then 2 weeks later he was gone. He was laying in bed, and a hospice nurse came into his home and started to take care of him. And it was the way that she took care of my uncle that made me realize that whatever she embodies, whatever she is doing right now, I want to be a part of. And I realized that over time that where my skill set really lies is getting all of the junk out of the way for people so that they can focus on what really matters, and that's taking care of patients.
Mhm.
I love one-on-one patient care, but I definitely feel like I'm better behind the scenes. And so being able to help clinicians, help providers get their services out into the market and provide good, high quality care, that was a really big eye-opening moment for me. I want to help those hospice nurses just like she helped my family, but not from the clinical side.
Not from the clinical side. Yeah, you know, it's very interesting. A lot of companies, including S2M Health, we are in the same, right? Like we want to help improve the business of healthcare, not from the clinical side, but the actual business, the processes, simplifying it. So health plans and care providers can focus on what matters most, right? Patient care. So I think at the moment, it's a very exciting moment with technology and how technology can help alleviate a lot of the challenges, right? Patient care has many different branches, and the business of healthcare has many different branches. For example, S2M, we deal with HEDIS and risk adjustment, right? Quality improvement and risk adjustment, everything related to value-based care as well. You touch many different areas, but of all of those areas, what interests you the most? Like, what is your focus, or what interests you the most?
Yeah, you know, that's a great question. Whenever I was speaking to a hospital CEO once, and she said to me one time that she felt like at least for her healthcare facility, that the only way that they were really going to turn around their operations and quality of care was through partnerships. Mm-hmm. And it made me realize that how powerful partnerships can be in healthcare, because you can partner with people that specialize in one very specific thing, or just a couple of very specific things. Mm-hmm. And so I realized that I am much better at bringing other people's fully baked solutions to the table than potentially bringing a half-baked solution to the table. So I like to find those people that have fully baked solutions that are really robust and can really solve really deep, nuanced problems, and bringing them to the table.
At the Healthcare Business Network, you consult with clients, healthcare clients, bringing those solutions that you mentioned. So what are the challenges that you're currently addressing for some of your clients? Can you just help us a little bit understand what the work you do?
Yeah, that's a great question. So I kind of coined this myself. I don't even know if this is the right way of saying this, but I call it the unknowingly problem. I think a lot of healthcare providers are unknowingly missing out on very serious opportunities for improving their quality of care, improving financial outcomes, operations, etc. So what I feel like I do a great job of, and what the Healthcare Business Network really brings to the table, is unraveling those unknowingly problems, helping healthcare providers realize that they are missing out on significant opportunities to improve their operations and business, and then bringing those people that can solve those problems to the table. There's a lot of unknowingly problems in healthcare. You have day-to-day operators that they're in the weeds, they're working day in and day out. They cannot always be sitting at a computer or on LinkedIn or at a conference finding out about the next greatest thing. So having somebody in the market that's constantly working on their behalf to find somebody or something that can solve a problem is really powerful, and really helps healthcare organizations kind of get a step ahead of some of their problems. So that's what we do, is we unravel those problems. We figure out what your problems are, and then bring those solutions to the table to solve those problems for you.
You know what? I wanted to start by asking you where you're located and your community there of healthcare that you're helping build. But before we go into that, what do you think is the blocker for providers to adopt the technology? Because what I've heard is, well, of course, they're busy, it's complex, HIPAA, right? They need to go to the due diligence of making sure data is safe first. Second, that it plays nice with other systems that they may have. The cost, of course. But in your experience, what you've seen, what do you think is the blocker for them to adopt new technology? And we're talking about providers, right?
Yeah, talking about providers. Yeah, that's a great question. I think, everything you said, yes, right? Like every single thing that you said, cost, technology, integrating that technology. I mean, legality stuff. There's all those kind of things. But what I think that really boils down to, and I think this is a reasonable thing, and that's fear. I think a lot of organizations want to bring these innovative solutions to the table, but they find these solutions so mired in complexity and then they see articles of Change Healthcare going through their tech problems and the cybersecurity attacks, and then just all these problems constantly being thrown at their face that they go, okay, well, whoa, that's too much. I don't know if this is something that's right for us right now. But the research shows in healthcare, we are really lagging behind in integrating new and innovative things. And I think for us to really make the impact that we really want to in the healthcare world, we have to partner with people that can alleviate those fears. We have to be able to find those people and alleviate those fears and work together and bring these solutions to the table, because yeah, it helps out our business, but ultimately it helps out patients.
Yeah, I think the behavior is changing. I've had conversations, and I think providers and health plans who've traditionally been very risk averse are more open to having conversations, learning about technologies, even if they don't necessarily know fully how they're going to integrate them or whether they want anything else, right? Like they know they have the challenges and they have to solve them. There is a risk, right, in everything they do. There's risk involved. There's the financial component and the clinical outcomes component. So there's a lot of risk for them really bringing new technology. But I've seen more openness to have the conversation and just learn what's new out there. And I always tell them, get the demo, the conversation. You have nothing to lose, and you can just learn more about what another company is doing. It may help you, it may not, but nobody can say like you don't know what.
Yeah, I think one of the greatest things that has happened to healthcare in the U.S. specifically recently is ChatGPT. And the reason why I think it's so great is because now people from their home computers can look at and play with these technologies in the safety of their own home. And then they're behind the scenes or they're in the clinical setting and they're going, wait a minute, this can solve administrative burdens. This can help me prove outcomes. And I think the same thing with what you guys are doing at S2M Health, all right? Like, I think they're starting to realize, so you're saying if you alleviate risk, you can take care of all these burdens for us, that we can get better at these things. And I think because of things like ChatGPT and these technologies, you are starting to see healthcare providers become a lot less risk averse. Though they are, at least in my experience, though they are becoming less risk averse, that means that they're now speaking to a lot of providers of these technologies. And so you have to really have a robust solution to stand out.
You really need to stand out. I agree. It's going to help weed out the solutions that perhaps don't have a real use case. And those solutions that actually help alleviate the challenges will stay. So there's no bad competition. I think we are all trying to solve the challenges for healthcare. It's a complex situation. Risk adjustment, for example, quality improvement are programs that are not going away. They will always need help. The same with care management. A lot of solutions in care management are coming up. The same with population health. I think there's room for improvement across, utilization management, prior authorization, etc. It can go on.
Not only are they not going away, they only have more of a spotlight on them now than ever, right? CMS is constantly changing and updating, and value-based care is becoming a hot topic, right? And everyone's thinking about how can we reduce risk, produce outcomes, and honestly, I think it's now more in the spotlight than ever. So,
I was recently having conversations about the new health equity index, and how STAR programs for Medicare Advantage are going to be impacted by it, right? Programs like that, or the focus on health equity now, it's going to continue. I mean, this is just health equity and what else. I think it's not so much that it's going to be more complex. I think it's going to be, there's going to be more focus on the things that matter the most, and health plans and providers are going to need help regardless, right? So it's an exciting moment. It's also kind of scary for some of the vendors, but I think overall it's a very exciting moment for us and for patients. I think for all of us, healthcare is just going to get better, more efficient, which hopefully that's the case. So working in the industry, Johnathon, what has surprised you the most about the state of healthcare in terms of innovation, the challenges? What has surprised you the most?
You know, I think it's you guys are constantly dealing with this at S2M Health, right? I'm constantly dealing with what I'm about to say in the Healthcare Business Network, but I was really shocked by the amount of administrative burden that healthcare providers face day in and day out. I've built technology and software for reducing administrative burden, and it's a big problem to solve. But, whenever you're a clinician going to school and you're a doctor going to school, you're not thinking about the endless amount of documentation and paperwork that you're going to have to work on. You're thinking about taking care of people. And even administrators, they know they're going to have to work with some paperwork, but goodness, the amount of paperwork that they have to deal with today is quite large. So I think administrative burden is something that really shocked me going into the healthcare space. However, with technology, I really see that improving in the future. I really, really, just based on the conversations I've had recently in this last week, traveling the country, I'm looking at all these healthcare providers, these vendors, and I'm thinking, if they can just get into the systems and do good work, healthcare is going to change pretty rapidly in the next 10, 15 years.
Yeah, I agree. The administrative burden is something that also surprised me.
Yeah.
No kidding. I mean, it's really, I think the main reason why healthcare in the US is so expensive. It's so inefficient in so many ways, right?
Yeah.
It's great in certain ways, but it's incredibly complex in many ways. So definitely something that I think other people in other countries will be surprised to learn too.
Yeah.
What do you see? We talk about administrative burden, and there are other areas obviously that need improving, but where do you see the biggest opportunity for improving healthcare delivery in the near future?
Ooh, I think there's a few things. So number one, I think being able to reduce the administrative burden from clinicians so that they can see more patients, take better care of patients. I think that's not only going to benefit the clinician side, reduce burnout, all of that, but it's also going to improve financial outcomes as well, I think, and quality outcomes as well. So reducing administrative burden for clinicians is one thing. Reducing administrative burden for administrators, again, you're going to see an improvement of quality outcomes. You're going to see innovation occur, right? If 8 hours of your workday is spent dealing with paperwork, you're not going to have a lot of time to think about innovating. You're not going to really have a lot of time to think about how you can find better ways of improving care. So I think you're going to start, once we're going to help solve the administrative burden, I think you're going to see a lot of problems improve from there on out. And I also think too, with technology, I think you're going to start seeing healthcare providers and health plans be less fearful of compliance problems. I once worked with a healthcare facility that was undergoing a massive audit. They're going to have to give millions of dollars back to Medicare simply for just not putting documentation in correctly. So having partnerships and technology that can help alleviate those compliance problems is going to make healthcare providers better quality outcomes, better financial outcomes, provide better jobs for people, reduce burden. I mean, there's so much I could talk about, but I think those are some of the things I see us changing in the future and improving.
Yeah, definitely. I mean, not accurate coding that is not accurate leads to a lot of issues for providers, health plans, it's a problem in the industry, and it continues to happen, which surprises me, considering there are companies like S2M and other vendors and other technologies out there to help alleviate that problem. But I wanted to talk now about your location, because I'm very interested about learning where you're located and the type of healthcare community you're helping build there. Tell us more about it.
Yeah. So I live in New Orleans, Louisiana, down south. You may have seen our state, Louisiana, and some Discovery channels talking about alligators and whatnot. But yeah, I live in New Orleans. Great city. I love it here. The city has been amazing to me. And one thing, and this is quite common in a lot of cities, but in New Orleans, we have a lot of healthcare competition. We have a lot of big providers fighting to provide the best quality care outcomes, have the biggest and best business they possibly can. And so I think there is a lot of competition, a lot of noise in New Orleans. However, the community that we're starting to build here with the Healthcare Business Network, I think is starting to cut through that noise and allow operators and innovators to come together and solve those problems face to face, instead of having to kind of be drowned in all the noise. And I think we're going to start taking the community that we're building in New Orleans, and we're going to take it across the country, because we're starting to notice that cities and providers and innovators across the country can really benefit from conversations like we're having today, right? I think they're starting to realize that there's really good opportunity in producing good quality outcomes and innovating whenever we have more of these conversations face to face. So we're looking to create a community not only across the country, but across the globe, where we can bring innovators and operators together to solve really big problems in healthcare. And we're just getting started. So I'm excited with what we're building.
That's awesome. I'm excited about that community. I think it's very smart to start in an area that is smaller than a big city, right? Sometimes I feel like in other cities, San Francisco or Los Angeles or New York, people work very separately. Yeah. Like there's not really a community of healthcare professionals sharing ideas on how to innovate, or just forget about innovation, right? Like how to solve the challenges that you have in front of you.
Yep.
Sure, there are conferences, but not everybody is able to attend a conference. Not everybody's there. LinkedIn groups, I don't even know. I'm a member of a couple, but I never see activity there. So I think having this local community of professionals is great. So I'm looking forward to the work you're doing.
And I appreciate that. The first healthcare business networking event we ever had, someone came up to me and said, there's just nothing like this.
Yeah.
And I thought that was really fascinating, right? Because I was just a guy who said, hey, I just want to connect with more healthcare providers and operators and vendors. I just want to connect. So I started reaching out directly to people, and we had our first event. It was a massive success. We had over 65 people show up for the first event. It was great. Totally unexpected. And I was asking people, how did you hear about this event? And they were like, well, you emailed my boss, and my boss forwarded that email to me, and then I forwarded it to my friends, and now we're all here. Gosh, we just don't have anything like this. And so I see us branching out from not only New Orleans, but all across the country, bringing more accessible events and opportunities for startup founders and operators to be able to start those conversations. A lot of conferences can be quite expensive. So to allow new operators and innovators into these events to have these conversations is something that we're really working on. It's really what we wanted to bring to
and to your earlier point about partnerships, right? Like I think vendors usually go to these events or networking thinking, who is there that I could sell to? And I think it's also important to network with other vendors to find opportunities for a partnership. When you don't compete, obviously. So we for example, at S2M are always looking for opportunities on how to partner, how to solve challenges together with other vendors. And I saw the resistance before. I think I'm seeing more openness now, but yeah. So some more vendors in this space are open to partnering with us and learning about what we do, and vice versa. So I think having these conversations with in the industry is the way to go So I'm looking forward to learning more and seeing future events.
I agree, and I really appreciate that. One other thing I want to say about that real fast is we take at the Healthcare Business Network extremely seriously. Whenever we have an event, we keep track of what everyone does. We want to know about what every single person is doing, what company they work for, because we want to connect people to other people that need their solutions. And then solve those problems. And we have a lot of skin in the game in ensuring that people have an amazing time. They get the connections that they're looking for, or they just make some new friends in the industry. So yes, I completely agree. We're excited about what we're building here.
Yeah, everything starts with just, relationships and, getting to know each other. Well, thank you so much for joining us today, Johnathon. It was great. I'm sure we'll have future conversations. We'll be in touch. Thank you for sharing your story and insights in the industry. And to our listeners, thank you for joining today. Be sure to follow S2M and the Healthcare Business Network on LinkedIn, to stay updated on more conversations like this. And until next time, thank you so much.